Namaskar and good evening. Your name for record, please.
My name is Rama M. Belagaja, and I worked at MIT with the Hargobind khurana for 7 years.
Wow.
After getting the training from him, I joined Eli Lilly and Company in 1979, and I used the technique of recombinant DNA technology to produce human insulin at Eli Lilly and Company. For that invention, I was awarded Padma Shri from the government of India.
When we talk about the human insulin
Yeah.
and your contribution to it, it has been earlier people were not detected with the diabetes, but now type 2 has become so common. And when we talk about the nation that you come from, and that is the diabetic capital of the world, so I must salute you for the innovation which has made a difference in humans' life actually, because it is in today's time it's not very easy, but certain things when it comes on a day-to-day usage, so it is very, very important. So how long it took, and can you talk about your experience about that?
Yes, it was a very challenging time. Previously, my invention, the people used to take the insulin made from beef or pork, and that insulin is different from the human insulin. When you introduce animal insulin into the body produces antibody, and that insulin is no more active. So that's why we started producing a human insulin. We cannot kill the human and isolate the insulin. So in order that, we have to use the technology called recombinant DNA technology. And that technology, I used my technology to produce it within 1 year. We discovered made the gene in a test tube and introduced into a bacteria to produce the insulin, and it took almost about 1 year.
When we talk about the company, like, because once you come with some innovation, so then there is a patent, and after that certain FDAs and so many regulations, and then it is open because now all the world, I think, means human race globally has been using this. It is not even from the same. So this is a very big contribution of that group of the people, because, and you said it has taken you complete 1 year because, but there was definitely something there before that 1 year that you could innovate and improvise.
It went so fast because the pharmacokinetics using the animal insulin is already established very well, and people used to take, and the doctors know they wanted a better insulin, So all the clinical data were available from the animal insulin. So when I produced the new insulin, it took only just see it is superior in that. That's why it went to the market very fast, and the FDA approved our drug very fast.
Which part of Bharat you are from?
I am raised from a small village in Karnataka state.
Okay.
Yeah.
Oh wow. And when did you come to US?
I came in 1967 to do my PhD at New York University.
Okay.
So I got my PhD. I joined in 67 and I got my PhD in 1971.
Oh wow.
And then I went to MIT to do work with the Hargobind khurana.
The Nobel laureate.
Who is a Nobel laureate,
Yes,
And everybody knows his name very well.
Thank you so very much for sharing such an inspiring. What do you see from 67 and now we are talking about 2023? What difference? You're settled in Indianapolis now.
Although I settled here because my research techniques are very superior here, but India has made tremendous progress since the independence we got in 1947. India has developed a lot of techniques, and even there is a company in Bangalore called Biocon. Kiran is
I met her. I interviewed her.
She also produce. They also produce the human insulin by a different technology. And India has made tremendous progress both in science and all other fields too.
Do you visit India?
How
often?
We visit almost every year.
Thank you so much for sharing your journey.
Thank you.
Really appreciate it.
I still love my country.
Thank you.